Good evening, Bruins. So nice to see so many of you here. Thank you for coming. And my name is Suzanne Seplow. I go by Seppi. I'm the Assistant Vice Chancellor within Student Affairs. And I'm really so glad that you're joining us today. As we've done in the past, we've put together a panel of a number of our key folks across campus to help answer any questions that you all have and to provide information to you about what's happening and where we're heading. And so with that, I also want to thank USAC, who has helped us collect questions ahead of time so that we can be most prepared to answer as many questions that you all have and be proactive in answering those. We will have a short time towards the end to be able to take some live questions as well. So we'll do our best to really get to what's on your mind and be able to continue to provide you information in this continued time of experiencing the COVID pandemic. So without further ado, I'm going to ask our first panelist from the academic side of the house. We have both the Dean of Undergraduate Education, Adriana Galvan, as well as Megan McAvoy, who is Professor and Co-Chair of the COVID Response and Recovery Task Force. Megan and Adriana, thank you so much for being here, and I'll turn it over to you.
So thank you so much. I will start off. I'm going to share my screen. I do want to say thank you for the invitation to join this town hall tonight. I'm glad to have the chance to talk with students, and I hope we can answer your questions. Okay, I've just shared my screen. Hopefully that everybody can see the screen. So again, for those of you that don't know me, I'm a professor here at UCLA, Associate Dean for Undergraduate Education in the Life Sciences and Co-Chair of the COVID Response and Recovery Task Force. I'm going to be tag teaming with Dean Galvan to talk about protocols, COVID protocols for students, and also we will move to winter instruction. I will cover the protocols relatively quickly because these have been published elsewhere. I just want to make sure that we're all on the same page going forward. And some things have changed relatively recently, so we do want to make sure that you're aware of these things. Some of the changes that have come down the pipeline are updated guidance around masking, updated requirements around masking. And I do need to say all students, faculty, and staff now need to wear upgraded masks indoors. And upgraded masks mean surgical masks, medical grade masks, KN95, N95s, or other types of respirators that are approved by NIOSH. So importantly, one thing that is not approved any longer are cloth face masks. Okay. So the good news is that students with a Bruin ID card can pick up free upgraded masks. That was as of yesterday from these places that I've listed on this slide. So we encourage you to go get these upgraded masks and please wear them. It's required in any indoor setting at UCLA. For students in residence halls, the UCLA housing front desks also have a supply available. We have hundreds of thousands of masks in stock currently on campus, so we expect to be able to provide them to anyone who needs them. Testing protocols have changed somewhat. There are some guidance here about students who have not yet traveled back to campus or Westwood area. We want to make sure that people test before they arrive on campus to make sure our case numbers stay low or as low as we can keep them. To test, again, 72 hours before or less than 72 hours before the return to campus. Upon arrival, take another test from a campus vending machine or distribution center, and then 3 to 5 days after arrival. I do want to point out that it's important to do the testing through campus vending machines or distribution centers because this is automatically linked to our databases. It helps us track cases a little bit better and keep if it's automatically listed to our database systems. It is now required that everybody has to do weekly surveillance testing regardless of your vaccination status. So please make sure to visit those campus vending machines or distribution centers and pick up a test and test at least once per week. Twice weekly is recommended, but to be compliant with the protocols, once per weekly testing is important. Okay, this is a slide with a whole lot of words on it, and I don't really think it's going to sink in unless you are in the situation of being in isolation or quarantine. So what I really want to point out on this slide is this website at the top about where you can find information if you are in isolation or quarantine. So isolation refers to students that have tested positive for COVID. Quarantine refers to those who have been a close contact and exposure. And so the information that I have on this slide, probably better to read on this website or review this slide later, has to do with the testing requirements that allow you to be released from isolation or quarantine, and how to count the days, like what that really means to be released from isolation or quarantine. And finally, I do want to point out that there are quarantine exempt individuals. So if you are a close contact, you don't need to quarantine. If you're asymptomatic and up to date on your COVID-19 vaccinations, or have recovered from a previous COVID infection within 90 days. So just want to make sure that people understand that there are different categories that may be applicable after a close contact. One of the questions that was submitted ahead of time, and again, yes, thank you for submitting questions ahead of time so we can make sure to cover these, was a question about parking on campus. Commuter and parking services did communicate to all student permit holders that they could cancel their permit for a full refund by Friday, January 14th, and then repurchase when the permit is needed at a prorated price. So Commuter and Parking Services is in the process of pulling together the data on canceled permits and expediting refunds to those students. Okay, I would like to talk for a moment about the decision-making process, about how we decide about campus operations and instructional modes, because I think it's not entirely clear to people what is factored in and the timeline of the decision-making process. I understand that decisions have been made and communicated on very short notice, and it's hard for students, it's hard for faculty, it's hard for staff, for all of us to adapt to changing circumstances. But I do want to point out that one of the reasons why these decisions are coming with relatively short notice is that we're trying to use the most up-to-date information that we have in order to make the best projections of where we will be, where we are, and where we will be in the near future. And so we are often waiting to have data to try to understand where we can move. And it's been particularly challenging with Omicron because this variant has presented us with situations that we haven't seen before with COVID. In particular, even back in December, we did not know how severe the infections would be that are caused by Omicron, or how transmissible it was. We have better information that we have now, but still I can't say that we know everything about Omicron. But the decision-making process, again, I want to refer you to the covid19.ucla.edu web pages, where there is a list of COVID protocols. One of those COVID protocols is the pivot plan and decision matrix, which talks about criteria that are used to initiate discussions about campus operations and what changes might be needed. They include these factors that I've listed here, things like hospitalization rates, test positivity. You hear a lot about numbers of new cases as one of the criteria, but I do want to point out that we're considering things that are happening not only at UCLA, but also in LA County. And so there's a lot of data that needs to be collected, and it changes very, very quickly. Again, thinking about Omicron and the challenge that it has presented is that things that we had not considered when this pivot plan and decision matrix were first put together had to do with the severity of cases that might be caused by Omicron and how campus operations might be affected when we have a lot of absences at one time. Would we still have the capacity to be able to feed students that are in residence halls, to clean our rooms that are across campus? Would we have the capacity to offer healthcare on campus? So all of those things factor into the decisions that we make, and hopefully you can understand it is a very complicated process, and a lot of factors are involved. The discussions that take place are with a lot of people across campus, not just the COVID Response and Recovery Task Force, but of course UCLA leadership and the Academic Senate all contribute to the conversations that talk about where we are going to go in the future. So at this point, I want to turn it over to Dean Galvan to talk about winter instruction.
Thank you, Megan, and thank you all for being here and seeking to get more information as we make decisions that you will get more information from today and then in subsequent correspondence from the university. Can you advance the slide, please? Thank you. So I will specifically talk about winter quarter instruction. As you heard from campus correspondents, we will return to primarily in-person instruction after January 28th, and that is still the plan. The Academic Senate graduate and undergraduate councils have approved a revised exemption process whereby instructors can request to continue teaching their course remotely if approved. I won't provide all the details just because it's rather detailed about how these requests will be approved, but they will be reviewed by the Education Working Group of the task force, which is the working group that I chair. And this means that at this point, since the deadline is not yet, is next week for faculty to provide those requests, we don't yet know how many requests we will receive, and therefore we don't know how many courses will be offered remotely. As I mentioned, the plan is to hold in-person courses, but some courses that are currently remote may stay remote, and some courses that are currently planned for in-person may move to a remote modality, but your instructor will let you know prior to the beginning of class when the modality that you will be engaging with that course. Instructors have been advised and encouraged to make every effort to accommodate students' reasonable health-related absences without undue penalty. So instructors know they're also experiencing what you're experiencing, which is a very dynamic circumstances due to Omicron and to changing circumstances. And so tomorrow, greater detail provided in a Bruin post that we expect to send out by end of day tomorrow.
Thank you.
Mm-hmm.
I just want to remind people about where they can look for information. Of course, the Bruin post will be coming out tomorrow, talking more about winter course instruction. But please look at the COVID-19 website at right here, covid19.ucla.edu for information about protocols, information for students. And of course, please use the UCLA mobile app, continue to complete the symptom monitoring survey, get your booster shots. If you have not already done so, the deadline is January 31st. I think I will end at that point. Just say thank you for the opportunity to be here today. If you have questions, please feel free to email me or email the covid19@ucla.edu email. Thank you.
Thank you so much, both of you, and critical information as we think about our instruction, as well as where to go to continue to get information. We know that there's a lot of information that's coming towards you in different ways, mostly through Bruin posts, but the websites, I want to just emphasize kind of how we continue to keep that information up to date and is a good go-to place for you. Next up, I want to introduce Dr. Chaitali Mukherjee, our Executive Director of the Ash Student Health Center. And before I have Dr. Mukherjee start, I just want to recognize the work of Dr. Mukherjee along with the Ash staff. They have continued to work tirelessly through this entire pandemic on behalf of our students and our student health. And also during this time of the Omicron surge, have gone nonstop in doing all they can as it relates to not only the treatment of our students, but the testing and protocols and processes in place. So truly outstanding work by our Ash entire staff and led by Dr. Mukherjee. So let me pass it over to you. Thank you.
Hello, everyone. I'm just going to go ahead and share some slides here. All righty. Well, let me make sure I can advance my slides. I just wanted to summarize just kind of the salient points of the updates you just heard. So remote learning, as you know, was extended until January 28th. Which has allowed more time for booster compliance. So for students, the deadline to submit your documentation that you received the COVID booster is January 31st for those of you who are booster eligible. And students who are not booster eligible yet will have 90 days after you become eligible to submit that documentation. We realize that people have different dates when they receive the vaccines. So because of the rolling nature of that, please note that you have 30 days to get that done. I strongly recommend you don't wait to schedule your appointment at the last minute. There is some vaccine scarcity out there. So as soon as you can, please schedule that appointment if you haven't already. Also, as previously mentioned, all students and staff, regardless of your vaccine status, will need to test at minimum once a week, although we do advise twice weekly during this period of mass transmission in the community for the duration of winter quarter. And as mentioned, everyone must use medical grade masks, and that means N95s, KN95s, KF94s, or the surgical mask, which will be available around campus if you don't already have them. So essentially what it means, this updated masking, is that the cloth masks that you may have previously used, gaiters, et cetera, those don't have the adequate protection for the highly infectious and transmissible variant that's circulating right now in our community. So I thought it would be helpful just to quickly recap some of the COVID data trends you may have seen and where we're at right now today on January 20th. So COVID-19 case rates and test positive rates have been fortunately declining at UCLA and in LA County. As many of you may have seen in the news, this has been an increase, a highly sharp increase in cases with the Omicron surge, but it does seem to potentially be turning the corner, although we still do see many cases that are transmitting. Things do seem to be somewhat more stable. This past week, we had 1,170 new cases compared to 2,100 the week prior. Our positivity rate of the surveillance testing that we're doing here on campus is showing 4.7%, which is down from over 8% the week prior. The UCLA rates of test positivity have continued to trend below what we're seeing in LA County, which is around 16.3% right now, reported on Wednesday, the 18th. I'm sorry, yes, Tuesday the 18th, compared to more than 20% the week prior. This is another visual of kind of how things are looking in LA County. So as you can see, the numbers are still quite high, but they do seem to be dipping down. We'll just need to keep a close eye on things. As you know, over previous surges, sometimes things can, go a little bit up and down, but it does look promising. And so we're monitoring the situation carefully. As far as what that means here is regarding the policies that were previously summarized, the vaccine rates within our community remain really high, which is a wonderful source of protection. Students are currently 99.7% compliant with the vaccine policy, and campus faculty and staff are at 98.4%. And booster compliance is also increasing. As of today, we are 69% compliant for the students who are booster eligible at this time. And this is up from 34% just after the new year following winter break. Regarding the isolation quarantine protocols, Megan had previously mentioned some of the details about that. I just wanted to highlight some of the salient aspects because we received many questions about this. So previously, isolation and quarantine timelines were 10 days. So isolation means what's necessary once you have been infected with COVID. Quarantine is something that's necessary after you've been exposed to someone as a close contact. Right now, if you test positive for COVID, after 5 days, you are eligible to take a rapid antigen test to clear yourself out of isolation if you meet certain criteria. If you are asymptomatic and you're improving as far as your symptoms and do not have a fever. So all people who are trying to do the shortened isolation period of 5 days will need to do a rapid antigen test per our current protocols. However, if you elect not to test or don't have access to testing or are not improving to meet the shortened eligibility criteria, you can just go ahead and do a 10-day isolation just like before, and there's no need for a test. If you have been exposed as a close contact, there are certain criteria for people who are exempt from quarantine. So that means those who are fully boosted, or those who have received the vaccines and are not yet vaccine eligible, or those who have been infected within the last 90 days with COVID. Those folks, if they have a close contact, do not need to quarantine. But for those who do need to quarantine, it's possible to be released from your quarantine after day 5 if you do a test. In the case of quarantine, it's necessary to do a PCR test. And we recommend that being done through the SwabSeq UCLA surveillance testing program, so you can obtain those tests through the vending machines or at a distribution site. For students who have tested positive for COVID outside of UCLA, we do need you to please email the UCLA exposure management team at the email that's listed here to let them know that you tested positive. For those of you who tested positive through the campus surveillance testing program, we already have your information, and you will be receiving a automated survey to put all of your information in a more efficient manner to the exposure management team. As previously mentioned, this surge has been quite high as far as the number of cases. So there is a backlog, and we were working through that backlog at this time. So thank you for your patience in allowing us this time to build these new processes in order to be more responsive to your needs. And with our increased staffing and some of these efficiencies, we think we'll be able to, over the coming days to weeks, provide the information that's needed. And also, as mentioned previously, the websites do have the up-to-date information that you can reference, so you know what you need to do. As far as the vaccine booster, there have been many questions about that. I just wanted to reiterate the importance of receiving the booster during this time of high transmission in our community. Many studies have been showing the data that supports receiving the booster because it increases the immune response to improve your protection against the variants that are out there. And vaccines continue to be very effective in preventing severe disease and hospitalizations. We've been very fortunate that this Omicron surge has not led to an increase in hospitalizations, and there's been none, in fact, that have been reported among our student body, and there have been no deaths among students as well. The January 31st deadline I mentioned earlier is for those of you who are booster eligible. Just to recap what booster eligibility means, for those of you who received Pfizer or Moderna and got your second dose at least 5 months ago, that's what makes you booster eligible if you haven't received that third dose yet. For those of you who received the single dose Janssen or Johnson & Johnson vaccine, if your single dose was at least 2 months ago, then you're eligible now to get that booster. And for those of you who may have received your COVID vaccine series abroad through the World Health Organization approved COVID vaccines, some of the names are listed here. They're called different things in different countries. If you completed your primary series abroad at least 5 months ago, then you are eligible for a booster here in the US. So students, and preferentially the booster we advise is either the Pfizer or Moderna, which are the mRNA vaccines. A single dose of that would qualify as your booster. So students must upload proof to the ASH portal by clicking on the medical clearance tab. And those of you who are not yet eligible for the booster, I just want to summarize again that you need to get your booster within 30 days of becoming booster eligible. For those of you who recently tested positive, UCLA is following the CDC guidelines, which recommends getting your booster vaccine as soon as your symptoms have resolved and you meet the criteria to end isolation. So you should not leave isolation in order to get this vaccine. As soon as you're able to leave your isolation, then you can get it. You automatically will have 30 days from the date you tested positive to get boosted. And for those of you who may have lingering symptoms or aren't quite sure if you should be receiving the vaccine, please do contact your primary care provider if you need a deferral up to 90 days. So anywhere from 30 to 90 days after your vaccine may be appropriate for you. Right now, the criteria for automatic deferral, which does not require any communication with the ASH immune team, if you end up getting it 30 days after a positive test, you should be all set. And actually, that's all I have right now. And I'll be happy to take questions at the end if there are any additional issues that come up.
Thank you so much. And so much critical information. And there is a lot of information that we're sharing. And again, if there's follow-up, we absolutely can make sure that we're pointing you in the right direction. Our protocols and processes are kept up to date and consolidated in our COVID website. So we'll make sure that you continue to get that information. Next, I have one of my dear colleagues, Sarah Dundish, who is our Director of Housing Services, and is going to share some information as it relates to housing. Welcome, Sarah. Thank you.
Thank you. Hi, everybody. I'm Sarah Dundish. So I'm here kind of representing the housing team, and I'm excited to share with you just kind of current information, where we are, and kind of now that some of this, really important information has been shared, what does that mean for our students who are with us, for our students who are coming? So first, I just want to confirm for all of our students that housing is operational. Our dining team is here. Everything, we are here and ready to support your residential experience. So, feel free to come on back. But the big and first thing, right? What's next is we're starting to get ready and closer to that January 31st date. How do students move back in if they haven't got with us yet? We are going to be, as soon as the communications go out, we're going to be reaching out to our students. And if you are undergraduate students who live on campus, remember that they needed to kind of sign up and schedule a specific move-in time. We're going to go through all of that again. And the reason why it's so important for us is because of the testing that Professor McAvoy went over, those 3 testings that were in that original Bruin post. We really want to make sure that we're giving the students the time to kind of check in gracefully, have the best experience they can, to get that rapid test upon arrival, still get the PCR test through our distribution centers here on campus or from the front desks, and make sure that you kind of go through that whole process before classes start. So because of that, we're going to have that even flow, and we're going to email all of our undergraduate on-campus students to go ahead and sign up for that time. And that will be coming out in the next couple of days. Additionally, I just want to kind of talk about now, once we get past the 31st, what does that mean? So for our students who had those 9-month contracts, which winter break is not even part of the contract, housing will be prorating your housing contract to the day that you arrived up to through the January 30th. After we get through there, the team will go back through and will reconcile your check-in date. And what we'll be doing actually is putting a credit on your housing account that will be applied to the next installment. You won't see that activity until after we get to that date, and we can really reconcile and make sure that we're taking care of those students those 9-month contracts who weren't here with us for winter break and are coming back now to stay with us. So that's a little bit of coming what's next. I think the most important thing about that, though, is that we'll be reaching out to you. So look for our email. We'll give you some very specific instructions on what to do if you're still coming to move back in with us into our on-campus community. For students who are already here, please keep doing your regular weekly or biweekly if you're opting to surveillance testing. That's been so important and really helping all the students here just make sure we're maintaining that Bruin bubble, as we call it up here in the congregate housing. So that's what's about to happen. So what's happening now in our housing? So I wanted to talk a little bit about our dining and our cleaning and our custodial team, because I know that has affected some of our Bruins that are living with us. First, for our dining team, everything is still to go. And we're going to maintain to go operations through the week of the 31st to make sure that we kind of get through that last big hurdle of check-in. That's kind of like fall quarter. If everybody remembers that very beginning of fall quarter when we had that sequestration and everyone got their food to go to kind of limit that mingling, that social interaction when the whole community is getting settled, we're going to mirror that and keep it going through that entire time just to make sure that we have the best start of in-person instruction that we can. For our custodial team and our dining team, just like all of you, everybody was affected with the positivity rates of Omicron. And the teams also had to get ready for that potential surge of isolation and quarantine housing. So our students have that moved in and have the private rooms where they do get the weekly cleaning. They've noticed that they haven't seen their regular housekeeper that they see every week. That's actually resuming next week. So traditionally for that first week of the quarter, there's never any cleaning because students just got here. But for the next 2 weeks, you haven't seen them. They'll be coming back this next week and they'll resume their normal schedules. For any student that's just like, oh, I really just wish I could wipe something down or something, you can go to your front desk and they do have cleaning supplies available if you just want to check them out. But those are, as you can imagine, like everything, a little bit limited to make sure we're disinfecting things, but those disinfecting wipes are available throughout your community. But next week, your custodian team will be back there with you in your rooms. Then the last part, I want to talk a little bit about IQ housing. I think you've heard the panelists, our experts, really talk about how you transition. How are you eligible for 5 days? What does it mean to be 10 days? And how do you make sure you follow the proper protocols? I just wanted to speak a little bit about, okay, you're positive. What does it mean? What do I do right away? How do I know I'm doing the right thing? So as Professor McAvoy said, there is a website that you can go to and you can see really nice infographics that walk you through. But I think the first and most important thing is call the hotline. We have an IQ hotline that is open 24 hours a day. So no matter when you get your test result, there's going to be somebody there that will be there to answer the phone, give you next steps, tell you what you need to do and where you need to go to make sure that you're getting access to the resources that you need. I think there's been a little bit of confusion about, we've had a lot of messaging around, if you can isolate at home, you should isolate at home. Or if you come first and you test positive, housing's going to first, hey, can you go back home and isolate? And that really was in response to just preparing for that surge that we were all expecting. And we really wanted to make sure we always had enough isolation housing for our students who need it, or maybe couldn't travel back home to isolate. And as you can see, and you saw the positivity transfer campus, those are starting to go down. Those not necessarily, once you're here with us, that's going to be your first question. However, we do know it's kind of more comfy sometimes if you have the ability to travel back home once you test positive to do so, you still will be able to. As soon as you test positive and you call that hotline, you can say, actually, my parents or my family friend or my aunt, whoever in your community is going to help you isolate safely. You can still go ahead and do that. But if you need us, we're here for you. And we have been since the very beginning and will continue to do so. Another, I think there's a little bit of concern about, well, what to do as we're watching those isolation housing numbers tick up. Do we still have enough capacity? We have a lot of capacity. And one of the nice things that was really great during this time is we were watching how many beds were being used. We still had enough capacity to take everybody. And we never got to one of those thresholds. If you do get a chance to look at that decision matrix, though, for students who are worried, our housing isolation capacity is one of our decision matrices that we watch. So senior leadership and the task force check in regularly to make sure that we still have enough beds, that we can still service our Bruins that are in need. And right now we're looking strong, and we're really excited to welcome our students back and continue to take care of any of our students who test positive and what they need. Once you're in isolation housing, there are phone numbers and resources that you can always call 24 hours a day. You're not just going to check in and are left alone. You still get your food delivered to you. And while we might not have a full menu order form right now to get through kind of the more increased isolation housing, we still are taking dietary restrictions, vegetarian, vegan, or any religious restrictions that you might have to dining. And part of the process when you check in with us is we'll ask you some of those questions just to make sure that we can take care of you. Additionally, residential life will check on you just to make sure your well-being. We'll check on, make sure that you're getting access to your classes. So once you're there with us, you're still part of our Bruin community. You're not going to be left alone, and we'll make sure that we can check in with you regularly until we can either get you out after your 5 days of isolation or after 10, and we'll be there with you the whole time. So I think those are my big updates for you. And at the end, if we have time, I'll take more questions about housing, and I'll turn it back over to you, Suzanne.
Thank you, Sarah. Appreciate all that information and the ongoing efforts. And I do want to just give a shout out for our dining and housekeeping and residential life and housing staff that continue to have come in and day out throughout this entire pandemic, almost 2 years now. Let me now turn it over to my colleague, Assistant Vice Chancellor for Campus Life, Mick DeLuca, to give us some updates. So take it out, Mick.
Thank you, Seppi. Let me just pull up some information here. And certainly welcome being here to share some information about student activities, some of our facilities, and our student groups. Want to provide some quick information related to indoor facilities. These were not open as part of the mitigation plans, the reassembly of campus, and the remote operations. I want you to know that all planning and all protocols have been approved related to those indoor facilities. And following the upcoming announcement in the Bruin Post, you'll see updated information related to the reopening of those facilities as early as next week. While the indoor facilities had remained closed and were pivoted for other uses, all of our outdoor activities are currently open for those that are in the Westwood area, including at Sunset Canyon, the variety of tennis courts, pools, lawn areas, and sand volleyball. At Drake Stadium, access to the track and steps, and we've moved weight equipment stations out in that area for outdoor training. The new intramural field, which was damaged during the August 22nd water main flood, has now returned. The south half is now open. The north half will be open by the end of the month, and it is currently available for open rec hours as listed. Our off-campus marina is available for water-based activities and currently free offerings for students. And on campus, the Hitch basketball courts are open and available for outdoor student activity. Some of the other pivots have been related to the testing centers. The John Wooden Center currently is a rapid testing location, and also the ability for PCR testing pickup, as Dr. Mukherjee mentioned. And you're well aware of the vending machines, but at both the Ash Center and the Wooden Center Loja, you can pick up a PCR test, and upon first entry, that's where rapid testing. We understand that all members of the community have not returned yet, including our commuter students, and based on the dates and the presumed reassumption of activities on the 31st, there will be rapid testing availability either at the Wooden Center, or we're currently looking at the possibility of the concourse at Poly Pavilion to be able to come and get that initial test before starting back into PCR testing. Also, as mentioned, related to the new masking, there will be distribution points at the Wooden Center, Student Activity Center, and all ASUCLA locations. So members of the community, if you haven't acquired that upgraded medical surgical mask, will have access to be able to pick up a mask at those locations. Related to student organizations, I know our staff in Seoul has been working with a number of groups. Over 1,400 groups are registered at the moment, And while it was indicated that there were no in-person meetings, programs, events, or activities through the 31st, the sole advisors have been coordinating with the groups. A number of events have been pivoted and rescheduled. We've worked with all venue managers on campus related, and we encourage the groups to continue to communicate with their sole advisors on the update, any virtual options, and then the scheduling or rescheduling related to those in-person upcoming meetings, gatherings, or upcoming events. And our student affairs departments across all the student service areas are in full operation. The guidebook provided by Student Affairs has ample numbers of resources, both COVID information, service information, upcoming hours. So I encourage you to check the guidebook related to those operations presently and as we all reassemble and come together back in person. Thank you, Suzanne.
Thank you, Mick, so much. For our last panelist right now, I am going to ask our interim dean of students, Jasmine Rush, to give us a bit of an update as it relates to compliance. Jasmine, welcome. Thank you.
Thank you, Suzanne. So I'm going to go ahead and I'll do a screen share. Okay, wonderful. And so as Suzanne said, I'm Jasmine Rush, or she, her pronouns. And I want to talk a bit about compliance in the way of COVID-19. And so Doctors McAvoy and Mukherjee talked with you about the requirements that we have for campus. And I'm going to summarize it in a way when you think of compliance as really following those MTBs, making sure that we're masking as required, ensuring that we're testing, as they said, on a weekly basis, minimally, and then ensuring that we have our booster by the deadlines, and then when on campus, when in those spaces, and making sure that we are managing symptom monitoring. And so when you think about compliance and enforcement, in September 2020, the procedures were established. And so I have the website here. It's actually the same one that Dr. McAvoy shared, and it has those enforcement guidelines. And so the most up-to-date one you'll see here was October 12, 2021. Within that document, I wanted to bring forward some of the key pieces that I think will be important for us as we talk about really how to keep each other safe in the way of compliance. And so it talks about compliance efforts, not just for students, but also for student groups. You'll see that it identifies various locations on campus and the compliance enforcement procedures. They include things like housing. They include things, for instance, with student groups, what they must do. I also wanted to make a note, because we don't talk a lot about this, but for compliance, it also means that for those who are in isolation and quarantine and who have those requirements, that they too must make sure that they're adhering. And then, of course, that document does spell out some information about the conduct process and potential outcomes for noncompliance. And so I do just want to say, I want to thank USAC for taking the time to pull together questions for us. And, you know, I know that there were some questions about testing. And so when you're thinking about accountability and compliance, are we in a situation where someone's not consistently masking? Are we in a situation where someone's not testing as required? Is it a situation where the booster hasn't been obtained by the deadline? Or are we in a situation where, for symptom monitoring purposes, someone's not cleared and is in a space? So that there's a spectrum there. In order to meet that, there are a number of things that can happen. And so students can receive holds on their accounts. Holds can do things like restrict enrollment. You'll see in that procedures document that I referenced that we talk about things such as interim suspension. And so a suspension could be interim or on a longer term basis. So there are any number of responses or outcomes that apply if we're in a situation where one of our students, a student group, is not complying and is not doing the things that we've asked in order to help us maintain safety on campus. And so should you be in a situation where you want to report something, there are a number of ways that we can do that. And so in both of the situations that I've outlined here, they both can be anonymous. And so you'll see individuals can report directly to the Office of Student Conduct. I have a few ways that you can do that here. We have a public reporting site. Individuals can email us, can call. Within that procedures document, it also talks about the whistleblower hotline. That's another location where persons can contact us should you want to report. Now, I do mention here that compliance issues or concerns can be reported anonymously. What is helpful in those spaces, and you may not always have this information, but ensuring that we know who the concern is about, that does help us ensure that we can do that follow-up, we can look into it, we can help maintain compliance. My information is up here, so if you have questions, if we're not able to get to questions that you might have this evening that involve compliance, please do reach out to me directly. I would be more than happy to talk you through that. You know, I do want to say I appreciate your attention. I appreciate you for joining us and doing all that you can do to help us maintain safety and to remain compliant with the requirements for our campus community. And so at this point, I'm going to pass it back over to Dr. Seplow. Thank you.
Thank you, Jasmine. I'm being upgraded mask compliant. So thank you all panelists. We have had a number of questions come in, and a number of the questions are questions that I know have been answered through the presentations. We will not be able to get through all of the questions, but we're going to try to get through a number of the questions that have been asked by multiple people. And so let me just kick it off and start, and I'm going to turn it back over and ask Dr. Chaitanya Mukherjee to come back on. And I would like if you could please answer in terms of if students who tested positive for COVID in the past 90 days, are they exempt from the weekly testing requirement? So if you could give us some insights, and then I also have another follow-up question after that.
Sure. So yes, if you have tested positive, you do not need to do the weekly testing until 90 days have elapsed from your positive result. And that's because you can still test positive on the PCR test for several weeks, even though you're no longer infectious. So those who tested positive through UCLA, so if you did the swab-seq oral saliva test that you got out of the vending machine or our distribution sites, you will automatically be exempt because we have your information already in your profile in the system. But those who tested outside of UCLA, when you found out you were positive, you will need to request your exemption by sending an email to exposure management team at ash.ucla.edu with a copy of your lab report or a note from your clinician confirming when you tested positive, so we can ensure that your symptom survey logic is updated so that you will still be clear to access all sites at UCLA without the weekly testing requirement.
Thank you. And then I know Jasmine just talked about compliance, but how is it in terms of folks, the accountability for compliance with testing?
So essentially what will happen is you need to test once weekly, and if you don't, you will basically have the potential is that you will have a hold placed on your student record. So that's one consequence, and a formal referral to the Office of Student Conduct if the behavior continues. So the main thing is that we are validating all of the testing information through the daily symptom survey. And so if you are not compliant with your weekly testing, your profile will be flagged and you'll get a notice to get in compliance. And if you don't get in compliance, then a hold will be placed on your record as well as the referral to conduct.
Thank you so much. I'm going to ask Dr. McAvoy to come back on as well. And so, you know, there's a lot of we've continued to get a lot of inquiries and not just inquiries, but thoughts from our students and from parents as it relates to an overwhelming sense of, will we be back in person? As well as, there's students who are asking, will I have hybrid options? And I know we've discussed this, and I don't know if Dean Galvan also wants to jump on this, but are we returning? The question is the plan to return to in-person on the 31st, and will there be, any kind of hybrid options as well?
Okay, thanks for the question. The plan is to return to primarily in-person instruction on January 31st. And as Dean Galvan had mentioned, there are going to be faculty that will continue remotely, though, that are teaching remotely. There will be some that have an in-person class potentially that will move remote, or there's going to be some short periods of potential remote instruction, even though the intention is to return to in person at some point before the end of winter quarter. There is some flexibility built in there because for pedagogical reasons, it may not make sense to move every class back in person at the exact same time, depending on the timing of exams or instructional modules that are being covered. And so we're trying to allow some flexibility again to cover those kinds of issues. Questions about hybrid instruction. We do not have a mandate for hybrid instruction for every course. That's not something that we can do because of academic freedom issues. But I think instructors have heard this message over and over and over about we're in some unusual times. We will have a lot of absences to deal with. Individual instructors are going to handle absences for their classes differently. Hybrid will probably be an option for some classes. The IT infrastructure across campus would not currently allow every class to be offered in a hybrid format, but recordings are prevalent. I think that faculty are making good use of the options to record. And so I think there will be ways to work with students who have absences due to illness. And we hope that, it's been a little bit of a rough start to the winter quarter. We hope that it finishes strong. Dean Galvan, do you want to?
Yeah, thank you, Megan. That's great. That summarizes what I was going to offer as well. And thank you for the question. I know that some motivations for asking the question about hybrid learning are taking into consideration students who are immunocompromised or who otherwise need accommodations. And I just want to remind and encourage students that all students with documented disabilities will be provided the course accommodations as per recommendations from the Center for Accessible Education, and that has not changed from pre-pandemic or during the pandemic. So if you are an immunocompromised student and that's why you would prefer hybrid learning, please do see CAE, who can provide you with the accommodations that you need.
Thank you so much. I was going to go right there. So appreciate the reinforcement for those students with, qualifying disabilities to be able to get appropriate academic accommodations. So thank you. Let me turn over real quickly. I know we're fast approaching the 6 o'clock hour, and Mick, I know you talked about this a little bit, but I'm going to bring Mick back, and will students be able to use campus facilities such as the gyms, recreation facilities, dining inside, which I will reiterate what Sarah had said a little bit earlier, as well as attend sporting events, including basketball games?
Yes, the plan is to resume indoor activities. There'll be information related. There will be the typical COVID protocols. And one of the key factors will be the daily clearance certificate, which will be checked upon entry to access to those facilities. But you'll look for information starting with some of the rec venues and other venues as early as next week. The intercollegiate athletic sporting events were announced to be spectatorless through the 21st tomorrow. That was 7 games, and there will be updated information listed over the weekend related to the upcoming contest starting next week.
Thank you, Mick. Appreciate that. There's been a number of questions in terms of tuition, and UC continued to deliver instruction throughout the pandemic and did not issue tuition refunds, as you as students were generally able to access all required instructional materials, complete your coursework, make timely progress towards degree, and earn full course credit. The mandatory university charges for tuition and student services help cover, our ongoing operational costs, such as the transition to and delivery of remote instruction, and the cost of student services, such as registration, financial aid, remote academic advising. So I know that that's been a question. I also know that there's been a question about student fees, and this continues to be an evolving and complicated topic, and that we hope to have more information to share with you in the very near future. I know there continues to be a number of questions that we're not able to get to, but I do want to share with you that we will do our best to answer the questions that have been presented to us tonight and get an FAQ out so that we can continue this dialogue. I also extend the entire student affairs colleagues that are on this panel, as well as the many different departments that you engage with as questions come up, to please reach out to us. We're more than happy to continue this dialogue with you. I want to thank our panelists. Everyone that's a panelist here continues to work tirelessly through this pandemic, doing all that each of us can to really kind of get our UCLA robust experience and community to what we know and love as Bruins. And so that continues to be at the forefront of our work. And I just want to thank the panelists for coming this evening and for the continued efforts as it relates to navigating this pandemic. I also, again, want to reiterate and thanks to USAC for helping to collect some questions, but also know that all the questions that have come in tonight and previously, we'll continue to do our best to be responsive to those. We know that this continues to be difficult. One of the things that we didn't talk about this evening is our mental health and well-being, and being responsible for our delivery of service around student mental health here. It's incredibly important for me to tell you that I know that the toll of COVID continues to take a toll on our mental health and well-being, and that we remain committed to doing what we can to support you through this navigation of COVID. Our goal is to continue to keep the community as responsive as we can to the impacts of COVID and the variants that are popping up, while really getting you back to the overall student experience that you desire. We also continue to recognize that while there is overwhelming sense of wanting to be back and be in person, that there is also our students that have challenges in terms of what it means to return. And so juggling all of that is our goal, and putting you as students kind of at the forefront of what we're trying to accomplish remains our mission. And so I just want to thank you all for coming. We will continue to host different town halls as we continue to live through this pandemic, and hopefully in the near future be on the other side of it completely. So again, thank you to the panelists. Thank you, Bruins, for showing up and your care and concern for one another and for this institution. And however we can continue to be of support, please reach out to us, and we're here for you. So thank you all for being here. Appreciate it. Go Bruins.